Stable angina pectoris is due to fixed atherosclerotic lesions that narrow the major coronary arteries, leading to inadequate perfusion. Stable angina occurs when oxygen demand exceeds available blood supply, when the coronary artery is occluded greater than 75%. It is characterized by chest pain or substernal pressure sensation that lasts less than 10 to 15 minutes, usually 1 to 5 minutes, but if it lasts greater than 30 minutes, consider an acute coronary syndrome. Pain is often gradual in onset, brought on by factors that increase myocardial oxygen demand, such as exertion, stress, or drugs, cocaine or methamphetamines. Patients with stable angina present with symptoms that are evoked by the same level of activity as climbing 2 flights of stairs or walking more than 60 feet at a time. This symptoms usually relieved by rest or sublingual nitroglycerin. Patients with a history of requiring less activity now to evoke the same symptoms, or patients with symptoms that fail to be relieved with 3 doses of nitroglycerin need to be evaluated for an acute coronary syndrome. Note that ischemic pain does not change with breathing nor with body position. Also, patients with ischemic pain do not have chest wall tenderness. If any of these are present, the pain is less likely to be due to ischemia.
I woke up with heartburn and gas this morning. Then this pain in my chest started. It was as if like a truck or an elephant or something was sitting on my chest. I had a little chest pain before, but it usually goes away if I sit and rest. I have some nitroglycerin in my pocket, but I've never taken it before. Should I take one now?
ECG or electrocardiographic is usually normal in about 50% of patients with stable angina, so normal ECG not exclude coronary artery disease. Although the ECG can be normal in asymptomatic patients, the classic findings are ST segment depression of at least 1 mm that is downward sloping during the ischemic episode and resolves after symptoms disappear. Stress ECG. It has the highest sensitivity in patients who have a normal resting ECG, so that changes can be noted. The patient's ECG and blood pressure are monitored during exercise using a standard treadmill or bicycle ergometer protocol. The positive criteria for stress ECG include: 1. Exercise-induced ischemia results in subendocardial ischemia, producing ST segment depression. 2. Typical anginal pain during the test. 3. Fall in blood pressure, 10 mm of mercury or more. Remember not to let any patient with a history of aortic stenosis perform a stress test. Sudden death may occur. Coronary angiography. Definitive test and most accurate method of identifying the presence and severity of coronary artery disease. The main purpose of angiography is to identify patients with acute coronary artery disease to determine if revascularization is needed. It may be indicated when non-invasive tests have failed to elucidate the cause of atypical chest pain. Indication for coronary angiography include the following: 1. High-risk stress ECG changes. 2. Convincing history with negative stress ECG results. 3. Symptoms uncontrolled by the use of 2 anti-anginal drugs. 4. Post-infarct angina or unstable angina. 5. Heart failure with angina. 6. Patient less than 50 years old with angina or acute MI.